The Ethiopian government is implementing wide-ranging policies to eradicate poverty through sustainable development, promoting peace and regional integration in the process. To improve the health and well-being of its people, the government has demonstrated its commitment to strengthening the public health sector. As Ethiopia's health minister between 2005 and 2012, Dr. Tedros Adhanom PhD spearheaded comprehensive reform and dramatically transformed Ethiopia's health system in the span of just 7 years. The core principles of Dr. Tedros' approach were innovation, collaboration and, crucially, community ownership. The transformative changes he brought to Ethiopia's health sector are testimony to his unique leadership style that gives primacy to country ownership and homegrown solutions.
Well, Ethiopia's medical expertise in terms of modern medicine is relatively young, if you want, about 100 years, yet the quality that's evolved in Ethiopia of the medical system is extraordinary. It really is one of the best of the world, partly because of the energy and fastidious learning that goes on there, and partly because of the huge challenges that Ethiopian medical system has had to deal with.
Well, I think it's done amazing things over the years. I mean, they've started from very, very little and have sort of built up this system of rural clinics and health extension workers, which have become internationally famous. I mean, it's now the envy of several countries in Sub-Saharan Africa, and it's achieved most impressive results in terms of the health indices, the improvement in mortality and so on.
His initiatives led to the rapid expansion of key health infrastructure, which included the construction of more than 3,500 health centres, from an original 600, and 16,000 health posts. These dramatically expanded access to basic healthcare for over 90 million Ethiopians. Dr. Tedros pioneered the revolutionary Health Extension Programme. The Ministry of Health, under his leadership, was able to train and deploy 41,000 community-based health workers across the country, the vast majority of them women.
They are young girls who have been given training. There's 2 in every village. They basically take care of 5,000 people, and they bring basic health services to them, to the mothers and the children and the whole community.
The Health Extension Programme fostered more assertive care-seeking behaviour amongst women in Ethiopia. It encouraged multi-level networks, building a sustainable health system with women at its core. The Ethiopian healthcare model is currently being replicated in over a dozen countries. When Dr. Tedros became Minister of Health, there were only 3 medical schools in Ethiopia and just 1 physician for every 30,000 people. By partnering with the Ministry of Education, Dr. Tedros devised and led the successful implementation of a wide-ranging national strategy for investing in Ethiopia's healthcare workforce. This resulted in an almost 7-fold increase in the number of health professionals in the country, from 16,500 to 115,000. In addition, every district in the country now has at least 1 well-staffed health centre. There has been significant, affordable and sustainable growth in the number of medical schools in Ethiopia, from just 3 training 120 doctors annually in 2005 to 33 medical schools training 3,000 doctors today. This was achieved within the infrastructure of Ethiopia's existing hospitals. A wide range of independent evaluations have confirmed that under the leadership of Dr. Tedros, Ethiopia achieved almost all of the Millennium Development Goals. There was a 2/3 reduction in under 5 mortality. Maternal mortality was reduced by 71%. HIV mortality was reduced by 90%. And deaths from tuberculosis were reduced by 64%. During his tenure as Health Minister and thereafter, life expectancy rose from 45 in the year 2000 to more than 65 in 2015.
In 2000, the average Ethiopian lived, that's 16 years ago, the average Ethiopian lived to only 47. It's now 64 and climbing.
You've got a Minister of Health who's one of the best in the world, Dr. Tedros.
The Health Minister of Ethiopia, now the Foreign Minister, one of the ablest public servants I ever worked with. You would all be very comfortable if he became the Secretary of Health and Human Services in the United States. A really able man.
Dr. Tedros is also a skilled diplomat and an impressive consensus builder. He is the only candidate to have served not only as Health Minister, but also as Minister of Foreign Affairs. And he has a proven ability to bring people together around common goals and drive collective action. As Foreign Minister, he brought together all 193 UN member countries to negotiate and agree on a global partnership for implementing the Sustainable Development Goals, many of which related to health. Dr. Tedros has also served in prominent leadership positions in major global health organisations and partnerships, leaving an indelible mark on international efforts to tackle the most pressing global health challenges. He served as chair of the board for the Global Fund to fight AIDS, tuberculosis and malaria, and of the board of the Rollback Malaria Partnership, and was co-chair of the board of the Partnership for Maternal, Newborn and Child Health. In the election for the next Director General of the World Health Organization, Dr. Tedros attracted the support of most of the World Health Organization Council members in the first round of voting. He has the unanimous support of the African Union, the African, Caribbean and Pacific countries, and many Asian, European and North and South American countries. In its 70-year history, the World Health Organization has never had a Director General from Africa, the continent hardest hit by many of the world's most pressing health challenges.
I do wish him the best. I think he'd make an excellent DG of the WHO, and I do hope he gets the job.